Introducing Sri, me, Shahira, Haushu, Madina, and Serene. And now, Haushu will present the first slide to you.
Contact lens deposits. Ta-da! What is contact lens deposits? Accumulation of materials on or into the matrix of contact lenses. Deposits reduce comfort, vision, patient tolerance, discoloration, and it may spoil the lenses. They may act as antigens for the development of giant papillary conjunctivitis. Most of these deposits can be removed with a surfactant, an enzymatic system, and a calcium-preventing solution. Deposition occurs in all types of contact lenses. However, deposits are more likely to form on a surface of a hydrogel contact lens. Based on the FDA groupings, FDA Group 2 are more likely to deposit lipids, while FDA Group 4 more likely to deposit proteins. However, do you know that PMMA are not subjected to any deposition? Whereas rigid gas permeable lenses, deposits are easily formed due to poor wettability. Types of deposits. There are two types of deposits, the organic and inorganic.
Okay, now we'll be talking about protein deposit. The most common deposit found is lysozyme, which is extracted by the ionic content of the material of hydrophilic lenses. Other protein deposits include lactoferrin, albumin, immunoglobulin A and G. It appears as a white, thin, partially opaque deposit. It may be transparent and recognizable only when it starts to separate from the lens surface or as the lens dries. The adherence of protein is stimulated by dry zones of contact lenses caused by poor lubrication or incomplete blinking. Proteins are deposited may also originate from the tears. It may lead to giant papillary conjunctivitis, which is shown in the picture.
Lipid deposit. Tear contains abundant quantities of lipids. When deposited on contact lenses, lipid facilitates the formation of other types of deposits. Decreases wettability of contact lenses. Causes poor distribution of tear on the anterior surface. Lipid deposition can be prevented by daily use of surfactant cleaning solution and lid hygiene.
Now we go on pigments deposit. In hydrophilic contact lenses, most pigment deposits vary in coloration from yellow to brown. Deposition generally begins at the borders, gradually covering the entire contact lens. Pigments actually originate from melanin, which is shown in the picture. And it can be removed by oxidizing agents, but at a risk of altering the nature of the contact lens.
Deposit originates from makeup cosmetics such as eyeliners, mascaras. Oil from these products can be deposited on a contact lens.
It's microorganism deposit, which include bacteria most commonly found are Pseudomonas aeruginosa, Staphylococcus aureus, and Staphylococcus epidermidis. Fungi can also deposit on surface, followed by filamentary growth that can penetrate the contact lens and destroy it. Other deposits on the contact lens provide nutrients for colonization for microorganisms and thus worsening the condition, leading to bacterial infection of the eye. Now we move on to FDA grouping of contact lenses.
There are 4 FDA groupings. FDA Group 1 has low water content, which is less than 50%, and it also contains non-ionic polymers. Some examples of these are Lotrafilcon A, which is found in Focus Night and Day, and Senofilcon A, which is found in AccuV Oasis. 2 has high water content, which is more than 50%, and it contains non-ionic polymers just like the FDA Group 1. And one of the examples is ProClear Compatibles, which contains omafilcon A, and nalfilcon A is found in Focus Dailies.
FDA Group 3 has low water content, which is less than 50%, and it also contains ionic polymers. The examples is balafilcon A, which has 36% of water, and it can be found in Pure Vision. FDA Group 4 has high water content, which is more than 50%, and it also contains ionic polymers. The examples are etafilcon A, which has 58% of water, which can be found in AccuView. The other one is ocafilcon D, which has 55% of water, can be found in Biomedics 55.
And now let's take a look at the advantages and disadvantages of the different groups. Before that, you should know that the tear protein adherence depends on the non-ionic or ionic nature of the contact lenses. It was also shown that the high water ionic, which is group 4 lenses, accumulate more protein over time than low water non-ionic group 1 lenses.
Let's now take a look at the comparison between the four groups. Group 1 has lower oxygen transmission, greater deposit resistance, and is durable. However, Group 2 has higher oxygen transmission and is greater deposit resistance. Group 3 has lower oxygen transmission, lower deposit resistance, and is durable. Group 4 has higher oxygen transmission and is lower deposit resistance.
Now, let's proceed on to the advantages and disadvantages of silicone hydrogel lenses. Firstly, silicone hydrogel lenses increases oxygen permeability. This is due to the inherent properties of silicone molecule, and this is due to the fact that oxygen is more soluble in silicone hydrogel than. Secondly, the inclusion of silicone into contact lens polymer mix has an impact on lens modulus, which is a measure of rigidity or flexibility. For example, first generation of silicone hydrogel lenses, example Ciba Vision night and day contact lens, generally has a high modulus than their high water content conventional hydrogel predecessors. This results in a lens that feels stiffer on the eye.
Now I'll be talking about the disadvantages of silicone hydrogel lenses. Firstly, it will decrease the wettability of the lens. Secondly, increases lipid interaction. And thirdly, it causes lens binding to be more prominent. These disadvantages can be overcome by surface treatment. However, as it is a silicone-based material, it will be a very difficult task. In addition, silicone hydrogel lenses may not be the choice for all patients, as these lenses are generally more expensive than non-silicone lenses, so a more price-conscious consumer may not prefer this option. Moreover, in some patients, the silicone material tends to attract more lipid deposits, which may cause blurry vision along with discomfort. Other patients are just not able to adapt well to the more rigid silicone material, which may result in some minor defects to the cornea's ability to function.
Lens discoloration.
Why?
Some of the factors are aging of lens material, drugs, cigarette smoke, eye makeup residue left on the anterior of the lens surface. With tap water have high content of iron. Finally, lenses that are exposed to chemical substances released in fire. Example of the color of the staining is white bright gray,
dark grey, black, red, pink, yellow, brown, green, and finally blue.
Now I'll be talking about lens contamination, which will be the last topic of the slides. What caused it?
This is due to chemical pollution from cars, factories, dust, metal in the air that get fixed onto the surface, and smokers who carelessly handle the lens when he has nicotine stain on his fingers. Hi.
In addition, hands that have previously been exposed to makeup or cleansing products. Example, hand creams that contain plenty of lipids appear to readily stick on the silicone hydrogel lenses.
Last but not least, makeup can also adhere directly onto the lens surface. How? During wear? During the use of makeup? When makeup floating freely in the tear film?
Oh.
Hope you learned something from the slides presented just now. The end. Sayonara!